Happy December. The holiday season is in full gear. How did we get here? Where did the time go? I'm not sure, but we're here, okay? And we are starting December off with a hot 2-part series topic, okay? December is Constipation Awareness Month, and we're going to start off by talking about bowel movements, motility, poop. It's all of the things people do not want to talk about. I get that. Now, before you go, ew, and stop listening and shut me off, please wait. I encourage you to keep listening, especially if you have a history of slow motility, constipation, gas, bloating, and other gastrointestinal symptoms that may, or even symptoms that may not be related to the gut, such as brain fog. Maybe you're pregnant and you're realizing, okay, bowel movements are slowing down a bit. That's a very common symptom that occurs during pregnancy. And I also think it's the perfect time to talk about this because during this season, we may be enjoying more fun foods, less fiber. We're out of our routine. Maybe we're not drinking enough water. There's external stressors during the holiday season, and constipation may run rampant, or even just slow motility. We're going to do a 2-part series. Today, part 1, I'm going to share with you 5 simple and effective strategies you can incorporate into your daily routine to support better motility and overall gut health. We're going to talk about the basics, okay? Next week with part 2, you are going to learn more and dive a little bit deeper into the nitty-gritty of things, especially if there's chronic constipation or maybe some supplements that we can add in to help support. We're going to talk prebiotics and probiotics, so please wait for that episode. I'm excited for you guys to listen to that one as well. Now, just a disclaimer for this episode and for future episodes, I am a registered dietitian. I am not a medical doctor. The information shared in this episode is for educational purposes only. It is not intended to diagnose, treat, or prescribe for any medical condition. Always consult your healthcare provider for personalized advice. And although I am a dietitian, I may not be your dietitian, but we can change that. If you want to schedule a one-on-one, dive deeper and talk about this, we can definitely do that. It can be a one-off appointment. It can be part of a package. Whatever you need, I am here to support you. So if you're listening to this episode today or even future episodes and you're like, I kind of want to ask her about this and that, go to the show notes and click schedule my free discovery call. It's a 15-minute combo with me where we can see if I'm a right fit for you and how the best way to move forward is. Okay, so we can figure that out and then go from there. I hope you guys enjoy today's episode, this 2-part series. Happy December and happy Constipation Awareness Month. Welcome to Strong and Nourished Mama, the podcast dedicated to helping busy moms thrive. I'm Val, functional sports dietitian, prenatal and postpartum fitness coach, and first-time mama. I'm here to guide you on a wellness journey with simple, practical strategies to keep you feeling strong, nourished, and energized every day. Whether you're juggling work, family, or finding time for yourself, I'll share tips on nutrition, health, and wellness tailored just for moms. So if you're ready to feel empowered and recharged, let's dive in to today's episode and start building a stronger, more nourished you. Enjoy the show. Let's get into it. Today we are talking all about constipation and bowel movements. And I talk about this with my clients pretty much on the daily. So I'm pretty used to it. And I realize that not many people are used to talking about their bowel movements or even hearing about bowel movements and constipation. But we need to get that out of the way now, okay? Especially if we're grossed out about it, get it out of the way now. We all poop. We all have bowel movements, hopefully every single day, right? And if not, I'm going to help you with that. Don't you worry. But we need to talk about this because one, our bowel movements, it's considered a vital sign. It's giving us really important information. So just like the other vital signs, like if your doctor were to take your heart rate and blood pressure and temperature, they're just making sure, okay, what's going on within the body? Is temperature elevated? Is blood pressure elevated? Is it because you're nervous or you just ran in here? Or has it been slowly creeping up over the years? What is going on? And so our bowel movements are going to provide information into what's going on just like these other vital signs. We have to start paying attention to them. And especially now, because it's Constipation Awareness Month. The International Foundation for Gastrointestinal Disorders recognizes December as Constipation Awareness Month. Their goal is to increase public knowledge of a common yet very understood condition. And I love it. They even use this hashtag constipation dilemma. So what is constipation? First and foremost, it really kind of depends on who you ask. Are you asking a doctor? Are you asking your friend? Or who are you asking, right? It kind of really just depends. Now, if we're looking at the Rome 4 criteria, the Rome 4 criteria is a symptom-based guideline, okay? It's a system for classifying and diagnosing functional gastrointestinal disorders, which are disorders of the gut-brain interaction, the gut-brain axis. This is used to help doctors diagnose complex gastrointestinal problems based on symptoms. And these symptoms may not show up on tests or have obvious physical changes. So with the Rome 4 criteria, when we're looking at constipation, people have to have 2 or more of the following, and it has to be more than 25% of all defecations of your bowel movements, okay? Straining, lumpy or hard stools, which I'll talk about in a moment, sensation of incomplete evacuation, which is it's not like you're getting everything out, okay? So you go to the bathroom, you have a bowel movement, and then you feel like you have to go back again because it just wasn't fully evacuated. Sensation of anorectal obstruction or blockage, manual maneuvers to facilitate defecation, and less than 3 spontaneous bowel movements per week. So 2 or more of those, okay? Now, when we're talking about lumpy hard stools, we're talking about a number 1 or number 2 on the Bristol stool chart. The Bristol stool chart is a validated tool that's used in research, and it actually has 1 through 7 of these different types of stool. It's with pictures and explanations, okay? And number 1 is separate hard lumps, pellets, pretty constipated. And number 2 is lumpy and sausage-like. If you're on my email list, which I highly recommend that you get on my email list, you'll find it in the show notes. You're going to be getting this in your email so that you can start to pay attention to your bowel movements. And it's also a really good tool to use if you have kiddos at home, because then they can point to the picture. So with the lumpy hard stools, as part of the Rome 4 criteria, that's a number 1 and a number 2 on the Bristol stool chart. When you're looking at the Bristol stool chart, we typically want to be a number 4, which is like a snake, right? Easy to pass, with ease, and no complications. When there's constipation and it's part of the Rome 4 criteria, it's going to be a number 1 or a number 2 on that Bristol stool chart. Now, in addition, you must have both of the following. Loose stools are rarely present without the use of laxatives and does not meet the Rome 4 criteria for IBS, okay? So this is for constipation. Now, chronic constipation affects up to 20% of adults and 16% of children in the United States. Anyone can suffer from chronic constipation, mild constipation. Anyone can suffer from this, but usually women and older adults are going to be primary people who are going to be suffering from chronic constipation. Those with constipation, only about 22% seek medical care, and those who don't are usually dissatisfied with the medical therapies offered, and that's because they are typically like Band-Aids, right? So we're not getting to the root cause. Like, why do you have constipation? Let's address this. Instead, it's, you have constipation. Here's a stool softener. Here's a colonic stimulant. Here's a bulking agent, right? And these are usually prescribed. You can get some of these over the counter as well. Not everyone can tolerate these, but let's say you start to take them, it starts to help, and you're like, oh my goodness, great. And we start to become dependent on these. Again, we're not getting to the root cause of why you have constipation in the first place. What's going on? And that's what we need to figure out. There are many factors that contribute to the development of functional gastrointestinal systems as well as constipation, and that includes age, your lifestyle. So into your lifestyle, we're looking at your nutrition, your movement, your sleep, your stress, medications, whether prescribed or over the counter, dysbiosis. Dysbiosis is an unbalanced microbiome. So we're going to get into this in future episodes, but dysbiosis is when you have an imbalance of good guys and bad guys within the gut microbiome. Okay. When you have a balance, just like a beautiful rainforest or other ecosystem, you're in eubiosis. So when there's dysbiosis, which it's very, very common, common, then that can be a common reason why people develop functional gastrointestinal symptoms, including constipation. Increased intestinal permeability. So you may have heard intestinal impermeability as leaky gut. Now, your cells within the gut, it's one cell layer thick. So if you compare that to your skin, which is multiple cells layer thick, thank God, right? Your gut is literally just one cell layer thick. And so a lot can happen to that one cell and cause damage. Your cells are very close together. And I always use the example of your hands. So if you look at your hands and you pretend like your fingers are glued together, nothing can get through, right? So if that's the same with your gut, what's happening is you have these tight junctions, glue between your fingers. These tight junctions are keeping these epithelial cells together. And that's so nothing that can't get through or shouldn't get through, like bad microbes, the bad guys, opportunistic microbes, or other toxins or undigested food particles, they don't actually get through into the bloodstream. Now, what happens with intestinal permeability is these tight junctions start to break off, and then your fingers can start to come loose, right? So now things can go through from the gut into the bloodstream, which causes an immune response. And then your poor epithelial cells are inflamed and angry, and these opportunistic microbes are starting to eat at the mucus that sits on top of these cells to protect it. And in future episodes, we will go way into more depth about this. But essentially, with leaky gut, with intestinal permeability, there are so many things that can cause that, and that can definitely be a reason why there's some constipation. Low-grade intestinal inflammation and psychological comorbidities. So that includes anxiety and depression. And this is because of that gut-brain axis. So you have your vagus nerve, which is the longest nerve in the body. It's my absolute fave. It goes from the brainstem all the way down the spine to the top of the tailbone. And along the way, it's innervating all of these different organ systems, majority of it being within the gut, also known as the enteric nervous system or the second brain. And you may realize this to be true because you're like, okay, when I get nervous or when I feel excited, I feel that within my gut, or I have this gut feeling, this deep intuition, right? That is because of this gut-brain axis and the vagus nerve. Again, in future episodes, we'll dive deeper, guys. Don't you worry. But when there is anxiety and depression, it's this highway, it's this bidirectional crosstalk from the gut to the brain and vice versa. And so that can impact the gut, and then the gut can impact the brain. How do you know if you're constipated? We have to perform the colon transit time test. Now, a colon transit time is just testing how long it's taking food to go from mouth to toilet. If you're on my email list, you can subscribe in the show notes. You're going to get the Bristol stool chart along with colon transit time handout, so you can actually practice this at home. I really recommend that everyone do this. Now, you're looking to see how long it takes food to go from mouth to toilet, and you do that by either having corn, beets, or activated charcoal. And on the handout that I provide, it goes into way more depth, okay? So you're assessing, okay, when you consumed, let's use the example, you have 3/4 of a cup of corn, that's the only time you eat it, you note the date and the time, and every time you have a bowel movement, you visually examine your stool. So before you flush, look in the toilet, okay? And you have to see if you identify the corn. Then you're going to note the first time that you see the corn and the last time that you see the corn, okay? We want our transit time to be around 24 hours. If you're a little over that, 24 to 48 hours, okay, that's fine. If you're less than 12 hours, that's way too fast of a transit time. You're more than likely having diarrhea, okay? That doesn't mean that if you're constipated, you can't get diarrhea. You can get diarrhea if you're constipated, and that's because fluid is going to kind of go around the crevices within of the stool within the colon. Even if you're having a bowel movement every single day, I still recommend doing the colon transit time. It's actually pretty common. I see people who have a bowel movement every single day. They're a number 4 on the Bristol stool chart. They do the colon transit time, and their transit time is like 3 days or 5 days. So they're not getting everything out within that 24, 48 hour max period. That's incomplete evacuation. That's constipation. We need to address that. We need to get things moving a little bit faster. Now, depending on your results, especially if you're working one-on-one with me, we'll be able to go over some of those things that can be helpful for that in a more individualized approach. I'm going to be talking about 5 simple and effective strategies you can incorporate into your daily routine that you can start with now. We have to focus on the basics. And then next week in part 2, we're going to dive a little bit deeper. I recommend performing the colon transit time to get a baseline of where you were at, even if you are having bowel movements every single day. If you've had constipation in the past, it's definitely something I recommend, and you're just getting more data, okay? We're just seeing how well everything is moving through. Now, the longer your stool sits in the colon, that is not going to be good for the gut and overall health, and of course, those unwanted symptoms of not feeling good, right? So when you're constipated, everything is kind of like backed up. So that's putting additional pressure on the stomach and the lower esophageal sphincter, and then upstream. So some people, it's very common to be gassy, bloated. In fact, those two symptoms are the top 2 symptoms for constipation. Now, it doesn't mean because you're gassy and bloated, you're constipated, okay? But it's very common that if you are constipated, you're going to have gas and you're going to be bloated. Everything's kind of backing up. Reflux is another symptom. So you're putting pressure on that lower esophageal sphincter, that muscle that sits at the bottom of the esophagus on top of the stomach. And that pressure is going to open up that lower esophageal sphincter. So acid is going to go up into the esophagus when we don't want it to. Nausea is a very common symptom. And as I mentioned before, even brain fog, right? You just don't feel good. Something is off. So we have to be able to get everything within close to a 24-hour period. If you do your colon transit time and you notice that it's 5 days or 2 weeks, which I have seen, then it's going to take time. It's going to take time to get close to the 24 to 48 hour time frame. We have to recognize that. We have to be patient, especially if you have been chronically constipated, right? So if you've been constipated for years or decades, a lot of the times people normalize these things because it's been going on for so long, they normalize it. It's not normal, but it's common, and therefore we normalize it. So we have to understand that we need to have a bowel movement every single day. Now, you may hear some doctors say, oh, a few times a week, you're okay. No. We need to have a bowel movement every day. And that's also because our gut is one of our detoxification pathways. So you have your liver working for you 24/7. I mean, everything within the body is working 24/7 nonstop. Praise, hallelujah. That's amazing. We have to support that. Your liver, your kidneys, and your gut are the ways we're detoxifying, whether it's what we're coming into contact with from our environment or whether it's coming from within the body endogenously. For example, you are making your hormones, estrogen, testosterone, progesterone, cortisol, and so on, and then you use it and then you have to get rid of it. Now with sex hormones, they're fat soluble, so you can't pee them out. You may be able to pee some parts depending on detoxification when you're making it more water soluble. But those items, those toxins that we're trying to get rid of, some of it needs to go through the stool. Now, the longer these toxins, these things that we need to get out of our body via the stool is sitting within the colon, then the easier it is going to be for it to reabsorb into the bloodstream. This can disrupt the gastrointestinal system altogether. It's going to impact inflammation. It's going to put more stress on the liver and systemically within the entire body. So then you have to it goes into the bloodstream, it goes into your system. You have to re-detoxify it, and your liver's like, yo, I just saw you. I just used all of these nutrients to get you out and you're back. Something we'll talk about in future episodes is the metabolism of estrogen, and the gut's really important for that. There are many reasons why we want to have a 24, 48 hour colon transit time, right? Being able to get everything out. It's really important. It's not only you're going to feel a lot better, but it's going to be these other things that are going on within the body that you can't necessarily feel or anything like that. Perform the colon transit time, see where you're at. And even if you do the colon transit time and you're within that 24 to 48 hour time frame, that is awesome. But these 5 simple and effective strategies that we're going to talk about, it's still something to continue to pay attention to. These things can be incorporated into your daily routine to support better motility and overall gut health. We have to focus on the basics. I know the basics aren't fun and sexy and like on social media, but you have to do it, okay? And we have to stay consistent with it. The consistency is key. just like we talked about last week with habits. We have to stay consistent with these behaviors, especially if there is chronic constipation. It's not just, okay, I did these 5 things and it's been a week. Like, why are my bowel movements still slow and number 1 on the Bristol stool chart? Well, it's going to take a little bit longer than that, especially if it's been decades that you've been dealing with this. Let's be patient. Let's give ourselves some grace. Number 1, water and fluids. We have to have enough water every single day. 1, because our body is consisted of about 60% water, which is amazing. And because water and fluid is going to help get everything out within the gastrointestinal tract, okay? It's going to help push everything down and go into your colon so that you can have a bowel movement and not straining either, right? It's an easy to pass bowel movement. Assess if you're starting your day with water before your coffee. That's something to think about with your habits, right? Put a sticky note in front of the coffee maker, drink, enjoy your water, and you can start sipping your water before you enjoy your coffee for many reasons, but also to support motility. Depending on your physical activity, how much you're moving, where you live, the heat, the altitude, all of those things, that's going to influence your daily needs, okay? If there is constipation, especially chronic constipation, we need to first assess how much water we're drinking now and slowly working our way up to 80 to 100 ounces. And again, it's individualized. So if you live where I live in Albuquerque, New Mexico, where you're at high altitude, it's very dry and it can get pretty hot in the summer months, then I'm going to be drinking a lot more fluid. I also want you to consider some herbal teas to incorporate. Herbal teas as well as green tea are going to be great because they have polyphenols and antioxidants, which can support inflammation. They can also help with motility, one of them being ginger. If there's chronic constipation, let's try to add in ginger tea daily. It's kind of nice because it's the wintertime. It's not really fun to have hot tea in the summer. Of course, you can brew it and then make it cold. But it's really nice to have a cup of warm tea in the wintertime. Now, ginger is a prokinetic herb, meaning it's going to help move things through. It's also highly, highly anti-inflammatory, okay? So that can be something you can add in. So number 1, water and fluids. Number 2, increasing real whole plant foods, real foods that have fiber into your diet. So this includes nuts, seeds, legumes, whole grains, fruits, starchy veggies, non-starchy veggies, incorporating more of these into your diet because we need fiber to be able to move things through. Now, the recommendation for fiber is about 25 grams for women and 38 grams for men per day. But research shows that if we're getting more fiber, it's actually not only going to help with motility and gut health, but it's going to help with overall health. Most Americans get like 12, 15 grams of fiber a day. We're not getting enough, right? Especially with processed foods, eating out. So we have to make a conscious effort to be able to add in real whole plant foods. I'm not asking you to go vegan or vegetarian. If that's your jam, that's amazing. But if you aren't vegan or vegetarian, I'm just asking you to add in a little bit more plant foods. If you follow me on social media, you're going to see that I typically with a meal will count how many plant foods that I have as well as protein. P, protein and plants, people. So we have to first see where we're at, right? How much are you getting now? Because if you're getting 10 grams of fiber a day and you try to get 30, that's probably not going to be fun because your gut's not used to it. You're probably going to get gassy and bloated, and we got to slowly work up to that, okay? Low and slow with the fiber. So see where you're at and then slowly increase from there. And you'll slowly do that by adding a variety of different plant foods. Now, something you can add in every single day is kiwi. 2 kiwis a day have shown to be really helpful for motility. Gary et al. Took this, it was a research study, took 121 healthy people with functional constipation and IBS constipation, IBS-C, and randomly assigned them to consume 2 green kiwi fruits a day or 7.5 grams of psyllium per day for 4 weeks. The people followed this for 4 weeks and then did a 4-week washout period and then did another treatment of this for 4 weeks. After the study, the researchers concluded that those who consumed the kiwi had significantly improved measures of gastrointestinal discomfort. So their discomfort went down, and they had a clinically relevant increase of at least 1.5 complete spontaneous bowel movements per week by just eating kiwi. How amazing is that? Kiwi, I think kiwi is delicious. This can definitely be something that you can start to incorporate. It's also a plant food, and it helps with motility. You can also add in 3 to 4 prunes a day, the real whole food, not the juice. Prunes have been shown to be really helpful for motility. And then, as I mentioned, just adding in those real whole plant foods, whole grains, legumes, fruit, starchy veggies, non-starchy veggies, nuts, and seeds. I want to give you an example of like a meal or a snack and how much fiber that it has. So let's say you typically have Greek yogurt and it's just by itself. How can we add fiber to that? There are plenty of ways. So if we have Greek yogurt and we add 1 cup of raspberries, by the way, 1 cup of raspberries has 10 grams of fiber. It is fantastic. So 1 cup of raspberries, 2 tablespoons of ground flaxseed, you put in some cinnamon in there, and then maybe a tablespoon of walnuts. Not only are you getting 28 grams of protein, which is amazing, but you're also getting 12 grams of fiber in one meal. And I just told you that most Americans get 12 to 15 grams per day. So you're just getting this in one meal. Now, if you currently don't have that much fiber in one meal, we got to work up to it. Go low and slow in terms of your dosing and increasing that. Something fun that you can also do to help increase plant foods is counting how many plant foods you're getting in a day and a week, okay? And then see if you can work up to 12 different plant foods in a day and 30 or more different plant foods in a week. This is because research shows that with at least 12 plant foods a day or 30 different plant foods in a week, gut health significantly improves. Microbiome health significantly improves. And that's because fiber from these plant foods are feeding your gut microbes. They're feeding the good guys. So the good guys are thriving. They're helping decrease inflammation. They're helping with motility. They're helping with your immune system. They're helping with structural integrity within the gut. They're doing so much. And so the plant foods are giving you fiber, of course, to help with motility, but they're also feeding your good microbes. That can be something fun too, is what can I add to my diet instead of what can I take away? If you're getting 3 plant foods a day, the goal is to get 4, and then the goal is to get 5, and so on. Don't try to go from 3 plant foods to 12 plant foods in a day. Now, it's different plant foods. So if you have oatmeal today and then oatmeal tomorrow, that doesn't count as 2 plant foods. It counts as 1 plant food. But you can change up your oatmeal by what you put in there, right? So the different types of nuts and seeds and berries. Number 1, water and fluids. Number 2, real whole plant foods, slowly adding that in. Number 3 is daily movement to help with the gut, and especially with constipation, to be able to move everything through within that 24 to 48 period. We need to add in movement. Now, if you're like, Val, I work out in the mornings or I work out in the evenings, that is amazing. Kudos to you. Keep it up. But what about during the workday? What about on the weekends? Now, I'm not saying that you have to move 1,000 miles an hour and be nonstop and never sit down. I'm just saying let's look at our workday. Let's look at our weekends and see where we can add in some movement, whether it's a light walk, whether it's some yoga twists, some cat-cow, anything that's going to help with motility in the gut. If you're just sedentary and you're sitting a lot, that's not going to be helpful for motility or energy or mental clarity or your hips, right? We want to get up and move. And so see where you can squeeze in, even if it's only 2 to 5 minutes at a time of movement. Number 4 is stress management. And this goes back to that gut-brain axis, the vagus nerve, as I mentioned. If we are stressed, or if you name that emotion, overwhelmed, anxious, depressed, low mood, sad, lonely, overwhelmed, whatever it is, that is going to impact the gut and vice versa. So when it comes to stress management and constipation, we want to be able to slow down. Deep breathing before you eat. We'll talk about this in future episodes. Mindful eating, connecting with the body, not only when you eat, but even when you have a bowel movement, okay? So this goes to our positioning of where you're at when you're having a bowel movement. Now, if you're trying to rush through it, like, oh my gosh, I just have to hurry up, that's not going to be good for constipation or motility. If you feel like you have to go to the bathroom, yet you're so busy and you have meetings and you just can't step away, and so you're holding it, that isn't going to be good for motility either. That's actually going to negatively impact that and then increase constipation. When you feel like you have to go, honor it. Go to the bathroom, take your time, take some deep breaths, and sit upright and try to see if you can get your knees above your hips. And usually that's going to be with elevating your feet. Okay, so just like if you were camping and you had to go squat in the woods to go to the bathroom, that is the position that we want to be when we're having a bowel movement. We want the knees higher than the hips, because what that does is it assists the pelvic floor and the other muscles within that area to be able to relax, so that your sphincter at the bottom of the colon can actually relax and open up so that the stool can come out. So we have to be in a good position. At home, if you can, get a squatty potty or find something, yoga blocks, whatever, to elevate your feet and notice the difference, okay? Make sure you're giving yourself enough time, but also make sure that you're not hanging out there either. So please, not only for sanitary and hygiene purposes, don't take your phone and sit on the toilet on your phone and scroll and slouch over and be there for 10 minutes, because that's not going to be good either. But put that away, go in there, be in a good position, sit upright, take some deep breaths, take your time. That will help with going to the bathroom and having a bowel movement. We have to be in that parasympathetic nervous system, that rest and digest, okay? With stress management, you can also incorporate breaks during the day, which would help with movement too. I talked about number 5 with stress management, which is your position. So number 1 is water and fluids. Number 2 is real whole plant foods. Number 3 is daily movement. Number 4 is stress management. And number 5 is position. So I brought 4 and 5 together. So really how you're sitting on the toilet, what's your position of the knees compared to the hips. If you can, get a squatty potty, okay? Elevate the knees so that you can be in a better position. So these are 5 simple and effective strategies you can start incorporating today, right now, into your daily routine to support better motility and overall gut health. So start paying attention to this, see what your baseline is. On the email list, you should have gotten the Bristol stool chart in addition to the colon transit time and a high fiber recipe. I forgot to mention that. You are getting a high fiber recipe for free. Perform the colon transit time, and if you have any other questions, schedule a one-on-one with me. Whether it's just a one-off or whether it's part of a series, you can find that link in the show notes as well, okay? And stay tuned for next week. Next week is part 2, and we're going to dive into the power of prebiotics and probiotics. A very, very hot topic, but something that we can use to help with motility. So be on the lookout for next week's episode. Thank you for joining, and I'll see you next time. Thanks for tuning into this episode of Strong and Nourished Mama. If you enjoyed today's show and found value in it, I would love for you to leave a written review on Apple Podcasts. Your feedback helps me reach more mamas like you, and I truly appreciate your support. Stay strong, stay nourished, and I'll see you next time.